Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today I'm talking to Jaakko Mustakallio about designing and implementing a unit dose medicines distribution system for a smart hospital in Finland. Why don't you start by introducing yourself?
I'm Jaakko Mustakallio. I'm a pharmacist and I'm a Chief of Development in Hospital Pharmacy here in Oulu University Hospital.
And can you give us a brief overview of your role, what your current job involves?
I do whole development process all the way from user requirements and tender process up to the consolidation and production phase.
First, could you tell me a little bit about Oulu Hospital, Oulu University Hospital, where it is, how big it is, what population it serves, those kind of things?
Oulu University Hospital is one of the 5 university hospitals in Finland, and we provide special healthcare over 400,000 residents. And actually, we have like 650 beds at the moment at our hospital.
I have seen that Oulu Hospital plans to be the world's smartest hospital. Can you tell me a bit about what this will involve, what systems are in use?
We use multiple automations in our hospital, all the way from the medical devices until the smart surveillance cameras and locks.
Could you say a little bit more about the smart surveillance cameras and lock system?
The cameras and the locks, they are all connected to the system, and we can control, for example, which groups of patients or staff goes to where. We can have an ID that maybe some person who is working at the wards, we can ID them from the cameras. Also, we can do something that if we don't want to recognize people, we can do the smart surveillance cameras and maybe blur their faces or something like that. It's for the patient safety and for the patient's rights.
So does that mean that if I visited your hospital and attempted to visit the intensive care unit, for example, the camera and lock system would recognize me and stop me?
Yeah, exactly. And also for the staff, it's the same. You only can go to the places that you are required to go. So not all the places you can go if you are staff.
And so if the hospital is going to automate everything that can be automated, does that mean that patients will be cared for by robots?
No, the main goal for the process is to liberate time for the nursing staff. And in hospital pharmacy automations, this means that we provide compounded solutions or medicines ready to use for the nurses, and they can use more time at the ward, near the patient, and less time in the office or in the medicine cabinet.
I see. Now I'd like to talk about automation in the hospital pharmacy and the unit dose project. Why has the hospital decided to implement a unit dose supply of medicines?
Yeah, maybe a little bit background for that, because currently all the medications that are given to the patient, they are delivered to the wards as an original packages, and from there the nurses distribute the medicine for the patients. This is really time consuming, and there's also you maybe have some errors, human errors in those processes.
And what benefits do you think a unit dose system will give you?
It saves time, and it's more because it uses automation. It's more reliable than we all are humans, and we make errors. But with the automation, I think we can decrease those errors in certain points, and we can also make checkpoints for different stages that we can check that we are still doing the thing that we are supposed to do. For example, if the medicine has changed or patient has something else that we need to think about or know about, the system will alert. Yeah, the unit dose is part of the closed loop medication administration, the process that we already have, but we want to make a next step for it. And with unit dose, we are able to do those steps. We can have more automated phases in patients' medication administration.
Can you tell us how the system will work? What equipment will be used?
System will work with our patient information system. It's the start. We have a electronic prescribing, and from the electronic prescribing, we have the information about the patient's medication. That information goes from the patient information system then to the unit dose, and from the unit dose, we then make the patient-specific therapy for a certain time, and then we deliver that therapy back to the ward with the PTS system.
You've just mentioned the PTS. Is that pneumatic tube system?
Yeah, actually, we have one of the largest pneumatic tube systems in the Europe at the moment. Hopefully, when our whole hospital remodeling is done, it's one of the biggest in the world. Maybe something like that. Yeah, but we use that a lot. Yeah, we use that for the medications. We use that for the blood products, for the samples, for the laboratory and pathology.
It must be a very busy system with things going in all directions.
Exactly, it's like 1,000 or 2,000 capsules going every day. I think that when we are all finished here, we have all our new hospital buildings up. It's 3,000 capsules going every day. So it's a busy system.
I see. Now, when you say capsules here, that means the container that goes in the tube. So this is how you are able to send medication just in time for the next medicine round.
Yeah, it only takes like 5 minutes or so to deliver from our pharmacy to anywhere in the hospital. So it's quite quick.
Now we understand a bit about the background. Can you tell me more about the unit dose system? What is this?
We have the Sinteco's unit dose system. It's actually like a two-phased system. We have the packaging robots, 3 robots that do the packaging from the original packages to the unit doses. So those small packages with the one medicine. That's the phase 1. And at the second phase, we have those storage units. They are also part of the unit dose. And we put those already packages that we have made. We put those packages in the storage unit. And from the patient information system, we have the information that goes through the integration all the way to the storage unit. And the storage unit makes the patient-specific rings, or what you call it, packages, and then send those to the ward with the PTS system.
Could you just clarify, what are the rings?
Yeah, we can discuss this first, but because the unit dose makes some unit doses make rings, we actually use clips. But the main thing is that there's like a 4 or 5 or whatever the amount is medications for the patients, and there's also a label at the front that says that this is the patient, this is the time of administration, and these are the medicines that we have collected. So it's a ring, or it's a clip, or it's a therapy, whatever you want to call it.
Could you tell me more about your unit dose system? What equipment do you have and what will it do?
Yeah, our unit dose system, it actually it has 8 machines or robots. 3 of those are for packaging, like the phase 1 packaging from the original packages to the unit doses. They are called oral solids, or OS, and all forms, or Omnia. They have these names. They are quite clever, yeah. And we also have 5 of those cabinets, storage units, that contains the unit dose packages, and they are actually the ones that makes the patient-specific therapies and make the delivery to the wards. They are called Pegasus. I'm not sure if that's something common, but it's also fun that they have those names. But yes, actually it's 8 machines, even though we talk that you need those system, but it's more complicated than that because it's many robots.
This must need a lot of space in the pharmacy.
Yeah, we have 150 square meters of clean room space for these, and we also have some more clean room for the original packages and for the staff but we have like a it's like a small factory, medicinal factory that we have in the pharmacy that has the you need those machines inside them. Many of people that they think that okay, you need those. It's one machine that is size of a truck or something like that. But
Yeah.
from our pharmacy, it's like cabinets, and that's the system. So it's the layout is different.
You mentioned that one of the machines packs the doses. So are you using bulk packs of tablets, or does the machine cut the packs but leave the blisters intact?
Yeah, we have the 2 phases. The first phase is the package. We actually have 3 machines for the packaging. But yeah, they all can do they cut the blisters so that the medicine stays inside and then repacks those in unit dose bags. Or we can use the same machines with the bulk tablets or ampoules or patches or whatever form that we like to package.
Mm. I see how this would work for solid oral doses, so tablets and capsules, but I think you mentioned ampoules earlier. Did I hear you correctly?
Yeah. Yeah. We can pack ampoules. We can pack, for example, transdermal patches. You name it, we can package it. I think so, more or less, because we have 2 of those packaging machines. They are called All Forms or Omnia, but they are capable of doing unit dose packages for almost everything. I
It,
think that we have only few different medications that we couldn't pack with those, but 99% of packages we can make with those machines.
and does that include liquid oral medicines as well?
Yeah, I think that the restriction is the size. For example, antibiotics, they are usually quite heavy, so they are not suitable for the unit dose. But other than that, for example, ampoules or some lighter packages like bottles or something, we can pack with those.
Interesting. I have some more questions about practicalities. How will the wards store the unit doses, or will they not need to store them? Will it really be a just-in-time delivery?
With the patient specific therapies, we are delivering them before the administration time. So there's no need to storage those for a long time. For example, the administration time is at 8 o'clock. We deliver those patient specific therapies around 7 o'clock, just before for the administration. So it's easy for the nurse to do the double checking and then maybe take some more medications that we are not providing, for example, antibiotics. They can take that also, and then go to the patient room and do the administration for all of those.
Now, a different question. How can a unit dose system work for as required doses? Things like paracetamol for pain.
At the moment, we don't make like emergency deliveries. We always deliver with our schedule. But if there's something that is needed right away, for example, for the pain or something other emergency, then we already have always have at the ward, we have a ward cabinet, ADC or wooden cabinet that contains some medications, these that are needed to be given right away or something that we don't have to supply from the unit dose.
Hmm. So would it be fair to say that the wards have a small supply of medicines for as required doses?
Yeah, they can have, and they will have small amount of most used medications at the ward, and hopefully in the future we also do that the unit dose packages are delivered to the ward's medicine cabinet or ADC. So, for example, we don't have to bring the whole original package to the one exact ward. There might be like 5 tablets in unit doses, and nurses can give those if needed.
Mm. And how is this monitored and controlled and topped up? Do the wards do it, or is it done by the pharmacy?
Yeah, we have automatic dispensing cabinets, and we have the uh, normal medical cabinets, but they also have the software for the storage control. And that's all pharmacy led. So if there's something that is missing or something that is too much, we have a group in our pharmacy that only do the logistics for the wards or for the ADCs and for the medicine cabinets. So it's pharmacy based.
Many people are concerned about the amount of plastic waste that a unit dose system can generate. Can you say anything about this?
There's some waste. We are moving towards the more easily to recycle materials. For example, less plastic and more paper, and some of the clips they are now plastic. Maybe we can have those from the recycled materials. But I think that in this point, the benefit that we have, even though we make some waste, plastic waste, but with the unit dose, we can reduce like a huge amount of medical waste or hazardous waste. And I think that's the other option, that even though if we're making little bit more with the plastic, if we can decrease the amount of medical waste, that's huge, because that's something that we have to deliver in one place in Finland, and they take care of it. And everybody knows that how difficult the medical waste is to recycle or even destroy.
Good point. Are there any plans to make this overall system more sustainable?
Yes. The Sinteco is developing that packaging materials that are from the recycled materials or use more paper and less plastic. And we are also testing those materials. We don't have them at use now, but that's something that we are also looking forward to.
And when will this unit dose system all be working?
Our goal is to have the first production phases starting at the end of this year. So maybe
And
7 or 6 months from here, we are up and running. First with a small amount of patients, maybe around 100 patients that we are doing like a testing, or it's like a pilot phase or something like that. But after that's concluded and we have the information from them, how does things work, and if there's something we need to adjust before we go further. But after that's done, we take one ward by ward, all the wards in our university hospital, to the unit dose process. And they are having the patient-specific therapies after that. That takes maybe 1 year at total, but we are really close to starting the production.
do the wards know that this new distribution system is coming? And if so, what do they think?
They are really keen. They have been waiting for this, because this is something that we have a lot of news in our hospital, and we have really much visitors here, and the nursing staff is really waiting because they see the benefit from this. So they are really waiting that they can be part of this.
Well, it sounds terrific from the pharmacy point of view. How has the rest of the hospital been prepared for these changes?
Actually, this uh, project is part of the it's one of the projects in our in-house project office. And that's the way that we work here. So we have the specialists for the certain needs, and then we have people from pharmacy to do the user requirements. And that's the same way that we develop all our new processes in hospital. So first they go to the project office. There's a certain amount of people with different skills, and they make the start, and then we have some users also attending, and after that the project is going with the project office until the production.
And you are a member of the team for this project?
Yeah, I'm a member of this in-house project office, and I have a team of my own for the pharmacy, and I think that we have really great people working here.
Now, how and why did you choose Sinteco as the supplier?
We are the part of the public healthcare, and we have the regulations for the tender process, and with the tender process and all those steps that we make, the Sinteco was the best offer. They had the best offer for that, and from that point we started to work with Sinteco, and I'm happy that we have started to work with Sinteco.
And my last question, how will you know if the project has been successful?
We will measure the saved time for the nursing staff, decrease of the mistakes in medication process, and also decrease of amount of medicinal waste, which we talked about before. Yeah, and also we have to measure the economics for the pharmacy and for the whole hospital. That this is also something that should should maybe scale up a little bit in other hospitals that are in our county.
Jaakko Mustakallio, thank you very much for talking to us about this exciting project. That has been most interesting, and we wish you every success. For more information about Jaakko Mustakallio's work and the Smart Hospital in Oulu, please visit the website using the links in the description, and be sure to subscribe for more news, journals, videos, and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.